The trauma doors blew open at 11:47 p.m., and the man on the gurney was dying in 4 different ways at once. Dr. Victor Hale was already laughing. Not at the patient, at the nurse standing in the corner, the one with the oversized scrubs and the clipboard pressed against her chest like a shield. "Get her out of my trauma bay," he said, loud enough for everyone to hear. "She's going to faint." The nurse didn't move. Her name was Ellie Marsh. 28 years old, quiet, slow to speak. The kind of woman people looked through rather than at. Nobody in that emergency room knew what she had done before she ever touched a stethoscope. Nobody knew what she was about to do now. Before this story goes any further, if you've never been on this channel before, right now is the time to hit subscribe and turn on notifications. Because what happens to Ellie Marsh over the next 5 parts is the kind of story that makes people forget to breathe. Hit the like button if you're already hooked, and drop a comment telling me what city or country you're watching from. I want to see exactly how far this story travels. Now, let's go back to that trauma bay. The night shift at Hargrove Medical Center in Tulsa started the way it always did, with fluorescent lights that buzzed just a little too loud, the smell of industrial cleaner that never quite masked what was underneath it, and the low-grade tension of a staff that had learned to be exhausted before anything even went wrong. Ellie Marsh clocked in at 11:15 p.m. She signed the attendance log, tucked her badge into the front pocket of her scrubs, and walked to the supply closet to check the cart she'd been assigned. Third bay. She liked the third bay. It was closest to the trauma entrance, and she always told herself that was a coincidence, that it had nothing to do with the part of her brain that had never fully stopped scanning for incoming casualties. The other nurses barely noticed her come in. That wasn't unusual. Ellie had been at Hargrove for 7 months, and she'd spent most of that time being precisely the kind of employee nobody worries about. Present, compliant, unremarkable. She filled out her charts on time. She administered medications without complaint. She documented everything with a precision that occasionally made the senior nurses uncomfortable in a way they couldn't articulate. What they told themselves was that she was forgettable. What was actually true was that Ellie Marsh was very, very good at being invisible. She was refilling a tray of saline bags when Donna Reyes found her. Donna was the night charge nurse, a compact woman in her mid-40s who wore reading glasses pushed up on her forehead like a second set of eyes she hadn't decided whether to trust yet. "Heads up," Donna said, not breaking stride. "We've got a trauma incoming. Military. ETA 4 minutes." Ellie set down the saline bag. "What kind of trauma?" "Explosion. Training facility outside the city. 1 confirmed critical, 2 walking wounded." Donna was already moving past her, pulling her radio from her hip. "You stay on saline replenishment and keep Bay 3 clear. Hale's taking the critical himself." There it was. Hale's taking the critical himself. Ellie had been hearing that phrase since her 2nd week at Hargrove, and she'd learned to map exactly what it meant in practice. It meant Dr. Victor Hale, Chief of Emergency Medicine, would sweep into the trauma bay like a man who'd been practicing for an audience, call out orders with the particular kind of certainty that doesn't leave room for second opinions, and anyone who suggested an alternative approach would find themselves on the wrong end of a conversation about scope of practice. She had learned to stay small around Victor Hale. She was still trying to stay small when the doors blew open. The gurney came through fast, paramedics on both sides calling out numbers, BP, respiratory rate, GCS. And Ellie heard the data before she processed the man. When she did process him, she went still. He was big. Even flat on a gurney, she could see the soldier in him, the shoulders, the jaw, the specific kind of stillness that happens when a trained body decides to conserve every bit of energy it has left. His left arm was wrapped in a field dressing that someone had done correctly under pressure, which told her something about the scene he'd come from. His face was cut in 2 places. His lips were moving. She couldn't hear what he was saying. "Bay 1!" Hale called, materializing from the far end of the corridor. He was already pulling on gloves. "Get me a full set. I want lines in both arms. Let's go." The team moved around the gurney with the practiced efficiency of people who'd done this before, and Ellie found herself drifting closer without fully deciding to. She told herself she was monitoring Bay 3 supplies. She told herself she was just nearby. What she was actually doing was watching the patient's chest. It wasn't rising right. The left side lagged a fraction of a second behind the right. Barely perceptible, the kind of thing you'd only notice if you'd spent years in conditions where missing it meant someone died. Ellie watched it happen twice, then 3 times, and something in her gut went tight in a way that had nothing to do with anxiety. She took 2 steps toward the bay. "Can I help?" she asked. Her voice came out quieter than she intended. Hale didn't look at her. "You're on bay 3. "I know, I wanted to flag something about the patient's Marsh." He said her name the way people say the name of a piece of furniture they've walked into. "Bay 3. She stopped. The team kept moving. She stood at the edge of the bay and watched them work. And she watched the chest, and she kept counting that half-second lag. Jared Kimball, one of the second-year residents, caught her eye from across the room. He gave her the look that she'd also learned to translate. The one that meant don't. The one that meant it's not worth it with him. The one that well-meaning people give you when they've already decided that nothing good comes from pushing back. Ellie looked at the patient. The patient's lips were still moving. She was close enough now to read them. Help. Or maybe not. Maybe she was projecting. She stepped back and pressed her back against the supply cabinet and told herself she was not going to do something she couldn't take back. She lasted about 90 seconds. "His trachea is deviated." She said it clearly, loudly enough to be heard over the monitor alarms, and the bay went briefly, fractionally quiet before Hale's voice filled the space again. "I'm aware of my patient's anatomy, thank you." "The deviation is new. It wasn't in the paramedic report from 4 minutes ago. His neck, Marsh." Hale turned now, and she saw his face, not angry, which would have been better, but amused. A specific, corrosive amusement. "Do you know what tension pneumothorax looks like on a chest film?" "I don't need a film," she said. "I can see it from here." The room reacted to that the way rooms react to a match being lit in a dry space. A collective intake, a pulling back, a few people suddenly very interested in their own tasks. Kimball was staring at his clipboard. Hale took a step toward her, and he did something she'd seen him do to other people. He dropped his voice, which was somehow worse than if he'd raised it. "You've been a nurse for 7 months, he said. 7. You passed your boards on the 2nd attempt. You've never worked a trauma bay in your life before this hospital. So I am going to need you to trust the physician in this room and go back to your assigned station." He turned back to the patient. "And get someone to move her out of my bay if she can't manage that on her own." Ellie stood there for 3 seconds. She felt the heat move up her neck. She was aware of everyone in the room performing the act of not looking at her, which is its own kind of looking. She walked back to Bay 3. She picked up a saline bag. She put it down. The patient's name was on the intake board. Tanner R. Male ill, 35. Military ID confirmed. The paramedic notes listed the mechanism of injury as blast concussion with secondary shrapnel wounds to the left lateral chest wall. Ellie stared at that board from 15 feet away and felt something happening in the back of her mind. Something she'd spent 7 months trying to keep nailed shut. She knew what a blast injury to the left lateral chest wall could do. She knew it with a specificity that didn't come from nursing school. She was 2 minutes into a silent argument with herself when she heard the monitor alarm change pitch. Not the steady urgency of a baseline alert. Something else. The kind of multi-tone cascade that meant more than one parameter had shifted at once, and shifted badly. She was already moving before she'd made a decision about it. The bay was crowded and loud, and Hale was at the patient's head calling for a laryngoscope, setting up for intubation, and Ellie pushed between 2 residents without apologizing and got close enough to see the patient's face properly for the first time. He was looking at her. Not through her. At her. His eyes were tracking with more clarity than they should have been, given what his vitals suggested, and for a moment the sounds of the trauma bay seemed to recede slightly, like a bad audio mix, and she was looking at a man who was trying very hard to communicate something before he lost the ability to do so. "If you intubate him now, you'll kill him," she said it to Hale's back. Hale didn't stop reaching for the laryngoscope. "Remove her from this bay." The tension pneumo is already compressing his mediastinum. The moment you put positive pressure in, his heart will stop. You need needle decompression first. Second intercostal space, mid-clavicular line right now before you touch his airway. Someone grabbed her arm. She didn't move. "I am telling you," she said, and her voice was different now. She heard it herself. And she suspected everyone in the room heard it too, that quality that had crept in without permission, flat and exact, and carrying a kind of authority that had nothing to do with her badge. That if you proceed with that intubation before you decompress, this man will die. and I will be standing here to document exactly what I said and when." Haley turned around. For the first time since she'd arrived at Hargrove, he actually looked at her. Not with amusement, not with the particular contempt he usually deployed. Something more complicated moved across his face. A recognition, maybe, that something in this room had shifted weight. And then it was gone, replaced by something harder and colder. "Get her out." Two people moved toward her. A security badge appeared. Someone said her name with the careful pronunciation that people use when they want you to understand you're being given one final chance. And Ellie looked once more at the man on the table, at his eyes, which were still open, still tracking, and let herself be walked backward out of the bay. The doors swung closed behind her. She stood in the corridor. She was breathing through her nose, short and controlled, the way she'd learned to breathe in situations where breathing incorrectly was a tactical liability. Her hands were steady. She noticed that separately, with a kind of detached interest. Her hands were completely steady. Down the hall, the ambulance bay doors hadn't fully closed from the initial intake. Through the gap, she could see the parking area outside, and there were two men in it who hadn't been there before. Military bearing, civilian clothes. One of them was on a phone. The other was looking at the hospital entrance with the kind of focused attention that she recognized from a different context entirely. She looked at them for a long moment. One of them looked back. She turned and walked toward the nurses' station, and she was halfway there when the trauma bay doors burst open and someone yelled for a crash cart. She stopped walking. She stood in the middle of the corridor with the sounds of a code behind her and something cold moving through her chest. Not panic, which people who've never been in real emergencies associate with this feeling, but something much more specific. The feeling of knowing you were right and having that knowledge land like a weight rather than a victory. She turned around. She walked back to the bay doors and stopped outside them, and through the porthole windows she could see the organized chaos of a resuscitation effort. She could see Hale, and whatever had been on his face before was gone, replaced by the rapid, narrowed concentration of a doctor trying to save a life with the tools that were no longer sufficient for the situation. The monitor was screaming. She pushed the door open. "I need a 14-gauge needle and a catheter," she said to the room. "Now." Nobody moved. "Needle. Catheter. 14-gauge. Second intercostal. Mid-clavicular. Someone hand me what I need or tell me where it is." Kimball moved. He was across the room in 4 steps, and he opened a drawer and held out the kit, and she took it without looking at him. She was already at the patient's side, already locating the landmark by feel. Second rib, count up, mid-clavicular line. And Hale was saying something, but she was not listening to Hale anymore. The needle went in. The hiss of released air was audible. It was the sound of pressure equalizing, of a chest wall giving back what it had been holding under compression, and Ellie felt it through the catheter before the monitor told her anything. The resistance giving way, the brief turbulence of release. And then the alarm changed. Not silent, but different. Better. The patient's oxygen saturation started climbing. Nobody said anything for about 4 seconds. Hale was standing 2 feet from her with the laryngoscope still in his hand, and she could feel him there the way you feel weather before it arrives. But she didn't look at him. She was watching the monitor and watching the patient and watching the slow, incremental evidence that the right thing had been done in time. Tanner's eyes opened. He was looking at her again. And then he said something that none of the 22 people in that trauma bay would be able to fully process before it changed everything. His voice was barely above a whisper, cracked and raw, and he had to push the words out individually like they cost him something, but every syllable was deliberate, and the room was quiet enough that everyone heard him clearly. "Sierra Kilo 7, Medic Marsh." The silence that followed was a different kind of silence than the one before. Ellie Marsh went very still. She looked at the man on the table, and he was looking at her, and in his eyes, beneath the pain and the oxygen deprivation and the residual confusion of a man who'd been in a blast, was absolute certainty. He knew her. Not as the nurse everyone overlooked, not as the woman who'd passed her boards on the second attempt, not as the quiet problem employee who'd just performed a procedure she had no business knowing how to perform with that level of precision. He knew her from somewhere else. He knew her from a context that didn't exist anywhere in her Hargrove personnel file. Hale was staring at her. Kimball was staring at her. Every person in that room was performing some version of the same recalibration, the same backward calculation. The question of who exactly was standing in that bay wearing those scrubs, holding that needle, looking at a Navy Special Operations commander like she'd already met him somewhere none of them had ever been. Ellie took one slow breath. She set down the needle catheter on the tray beside her with absolute control, and she straightened up, and she looked at Victor Hale. "He needs a chest tube and a surgical consult," she said. "His systolic is coming up, but it won't hold without drainage. You have maybe 20 minutes before the pleural space reaccumulates." Her voice was completely level. Hale didn't move. "Who are you?" he said. It was the first time he'd spoken to her like she was a person rather than an obstacle. She didn't answer him. She stepped back from the gurney and looked once more at the man whose life she had just preserved. And Commander Ryan Tanner looked back at her with the expression of a man who had just found something he'd been looking for without knowing he was looking. And outside in the parking lot, through the corridor windows she couldn't see from here but could locate precisely in her mind, two men in civilian clothes were walking toward the entrance of Hargrove Medical Center with the unhurried, deliberate stride of people who have already decided that whatever they find inside, they are prepared to deal with it. The trauma bay was still humming with motion, people repositioning, supplies being exchanged, the low register efficiency of a team that had just redirected its energy. But underneath all of it, underneath the monitors and the squeaking shoes and the oxygen line hissing softly in the background, something had cracked open that couldn't be closed again. A woman they had spent 7 months not seeing had just stepped into the light. And she had not done it gracefully or triumphantly or with any of the theatrical clarity that comes with a story that knows it's being told. She had done it because a man was dying, and she was the only person in the room who knew exactly what to do about it. That was all. That was enough. And Victor Hale was still standing in the center of his trauma bay with a laryngoscope in his hand, and the slow, dawning awareness spreading across his face that the woman he had just tried to have removed from his emergency room had in the preceding 4 minutes done something he could not explain with any file he had access to. And that those two men walking through his front doors right now were about to make that problem considerably larger. The two men came through the ambulance bay entrance without stopping at the front desk. That was the first thing Donna Reyes noticed. Not their clothes, which were unremarkable, dark jackets over collared shirts, the kind of deliberately neutral outfit that people wear when they don't want to be categorized, but the fact that they bypassed the intake window entirely and walked directly toward the trauma corridor with the unhesitating confidence of people who already knew the layout. She stepped into their path. "Excuse me, visitors need to check in at—" "We're not visitors." The taller one showed her something in a thin leather wallet. He didn't hold it open long, but long enough. "Commander Ryan Tanner. He came in approximately 12 minutes ago." Donna looked at the wallet, looked at his face, and made a fast internal calculation that most charge nurses develop after a decade on the floor, the kind that runs on instinct rather than protocol. "He's still in Trauma Bay 1. The physician in charge is Dr. "We know who the physician in charge is," the second man said. He was shorter, broader across the shoulders, with a jaw that looked like it had been broken at least once and healed slightly wrong. "We need to see the person who treated him." Donna blinked. "Dr. Hale is not Hale." The taller one was already looking past her, scanning the corridor with the particular kind of gaze that doesn't miss much. "The nurse." In the corridor outside Bay 1, Ellie heard that. She had been standing 6 feet from the bay doors, not quite leaving, not quite returning, occupying the ambiguous space between a decision she'd already made and the consequences it was about to generate. She had her hands loose at her sides. Her badge hung from her lanyard and twisted slightly in the recycled air of the hallway, catching the fluorescent light. She turned. The taller man saw her before she'd fully completed the motion, which told her something. He walked toward her with a directness that wasn't aggressive but left no room for misinterpretation, and when he was close enough that they didn't need to project, he stopped. "Sergeant Marsh," he said quietly. Not a question. The word sergeant hit her somewhere between the sternum and the throat. She hadn't heard it in 2 years and 4 months, and she hadn't realized until this moment how much of her energy she'd been spending on not hearing it. "I don't use that name here," she said. "I know." He didn't apologize for it. "Agent Dex Calloway, Defense Intelligence. This is Agent Bram Okafor." He tilted his head toward the broader man, who nodded once. "Commander Tanner requested you specifically. Before we go in there, I need to know, Does anyone in this facility know your service record? No. You sure? I kept it clean when I applied, civilian credentials only. She paused. I'm sure. Calloway studied her for a moment with the flat, appraising look of someone who makes a living deciding whether to believe people. Then he nodded. Okay, we're going to need about 20 minutes with the commander once he's stable enough to talk. After that, we'll need you present. I'm still on shift. We'll handle that. I'd rather handle it myself. Something shifted slightly in his expression. Not quite respect, but its precursor. Then handle it. We'll be with Tanner. He glanced at the bay doors. And Marsh, whatever just happened in there, whatever you did, we need to talk about that too. He didn't say it like a threat. He said it like a fact that neither of them could afford to ignore, which was worse. They went into the bay. She stayed in the corridor. Behind the bay doors, she could hear the recalibrated sounds of a stabilizing patient. The monitors running more smoothly now, the team's voices dropping from urgent to methodical. Someone was ordering the chest tube she'd recommended. Someone else was calling radiology. The particular quality of sound that means we pulled him back rather than we lost him. She let herself absorb that for exactly 3 seconds. Then she heard Victor Hale's voice, and the sound of it located her back in the present with uncomfortable precision. He came out of the bay still snapping off his first glove, which he did with unnecessary force, and he saw her in the corridor and stopped walking. The expression on his face had moved through several iterations since the last time she'd seen it up close. The confusion, the calculation, and what it had settled on now was something she recognized as more dangerous than anger. Anger runs hot and burns through. What Hale had was cold, and it was organizational, and it had the particular shape of a man deciding that what happened in that room was a problem he needed to solve before anyone else framed it for him. My office, he said. Now. I'm on shift. Marsh. He moved closer, dropped his voice. That stunt you just pulled in my trauma bay. Saved your patient. Was an unauthorized clinical intervention performed outside your scope of practice. And if you don't understand how serious that is, then you need to come with me right now so I can explain it to you in language that will hold up in a disciplinary hearing. She looked at him steadily. His SAT came up 14 points in 90 seconds after decompression. His BP is recovering. If I'd waited for you to intubate him, we wouldn't be having this conversation because he'd be dead and you'd be documenting a code. You don't know that. I know exactly that, and so do you. His jaw tightened. The glove he'd been removing was now fully off and crumpled in his fist, and she watched him do the thing she'd seen him do with other staff. The slow breath, the recomposition, the transformation of the raw emotion into something more controlled and more usable. You performed a needle decompression, he said. Do you understand what that means from a liability standpoint, from a board certification standpoint? You're a nurse, not a physician, not a PA, not... I know what I am. Then act like it. He pointed toward the far end of the corridor. My office. You can either come willingly or I can call HR right now and we can do this with 3 more people in the room. Your choice. She thought about Calloway inside the bay. She thought about 20 minutes. Give me an hour, she said. Excuse me? 1 hour. I'll come to your office in 1 hour. The patient is stable, the team is handling the chest tube, and there's nothing in that bay right now that requires either of us. She held his gaze. 1 hour, Dr. Hale. Then I'll answer every question you have. The silence between them was the kind that has texture. She could feel him deciding whether to push it, calculating whether forcing the issue right now gave him more or less leverage than waiting, running the internal math on which version of this confrontation was more useful to him. He pointed at her. Not a threat exactly. A marker. The kind of gesture that means I'm noting this moment as the beginning of something. 1 hour, he said. Then he walked away. Ellie let out a breath through her nose and turned back toward the bay. She was not going to Hale's office in 1 hour. She was maybe not going to Hale's office at all. But she needed 60 minutes, and she'd bought them. And right now that was the only currency that mattered. The chest tube went in cleanly. Not her work. Kimball's, which surprised her a little because she'd underestimated him. And by 12:40 a.m., Commander Ryan Tanner had been moved to a monitored bay with an IV running, his oxygen saturation sitting at a respectable 96%, His blood pressure stabilized at 118/74. Not perfect, but alive in the specific stubborn way that big men with strong constitutions tend to cling to life, even when the situation strongly suggests otherwise. Calloway and Okafor were already in the bay when Ellie was cleared to enter. Tanner was awake. Mostly. His eyes tracked her as she came through the curtain, and she watched him perform the small physical inventory that soldiers do when they regain consciousness in unfamiliar places, checking what worked, what didn't, what the environment was telling him. He was fighting the sedation the way people do when they've been trained not to lose situational awareness, which meant he was getting more alert every 30 seconds, despite the fact that his body would have preferred otherwise. "You look worse than last time," Ellie said. His mouth curved. It was barely a smile, more the ghost of one, but it was real. "Last time I got shot. This was a blast. Completely different experience." His voice was rough, abraded by the oxygen mask that had been on his face 20 minutes ago. "I wasn't sure it was you. At first. The haircut threw you off. The scrubs threw me off." His eyes moved to Calloway, then back to her. "You didn't tell anyone?" "No." "How long have you been here?" 7 months. I was quiet for a moment, and she watched him absorb that. The full weight of what 7 months in a civilian hospital in Tulsa, being overlooked and condescended to and categorized as unremarkable, meant for someone with her record. She saw him decide not to say anything about it, which was the right decision. "The explosion tonight," he said. "It wasn't an accident." The curtain shifted. Calloway moved half a step closer. "Tell her," Tanner said to him. "She needs to know." Calloway glanced at Ellie with the expression of a man recalibrating how much to share, then apparently decided Tanner outranked his reluctance. "We've been tracking a procurement irregularity for about 4 months. Defense contractor out of a shell company registered in Nevada. They've been supplying modified training equipment to 3 special operations installations. The modifications are subtle, hard to detect on inspection, but under operational conditions, blast overpressure, high-stress environments, they fail in specific ways. They fail toward the people using them," Okafor said from the corner. It was the first time he'd spoken since the hallway, and his voice was lower than she'd expected, deliberate. "The device that went off tonight," Tanner said, "was attached to a piece of equipment that cleared 3 separate inspections. It shouldn't have been able to detonate. Someone with access to the installation's inventory system had to have flagged it past the safety checks." He paused to breathe, which cost him something. "2 of my guys were standing 15 feet away. If they'd been 10 feet closer—" "They weren't," Ellie said, "this time." He looked at her. "There's a supply manifest from the last inspection cycle, physical copy. It was supposed to be transferred to the base records office, but it never arrived. Someone pulled it. We think whoever pulled it knew we were getting close, and we think they're going to move to cover the rest of the trail in the next 48 hours. "Where's the manifest now?" she asked. Calloway and Tanner exchanged a look. It was the kind of look that travels fast and carries a lot. "We don't know," Calloway said, "but we know who last had it." The name he said next was not a name she recognized, but the institutional affiliation attached to it, a mid-level contracting officer with clearance to both the physical supply chain and the digital record system, landed with a specificity that told her this wasn't a preliminary theory. This was a trail they'd already mostly followed. "Why are you telling me this?" she asked. "Because Tanner says you're the only person outside the investigation he trusts completely," Calloway said. "And because we may need someone in the next 48 hours who can move in civilian spaces without attracting attention." He looked at her scrubs with an expression that was not quite ironic but came close. "You've apparently been practicing that." "I'm a nurse." "You're a lot of things, Sergeant." She let that sit for a moment. "You want me to go back undercover?" "We want you available," Calloway said. "That's different. No active insertion, no field work, just available, reachable, in case the situation moves faster than we're anticipating." "And if it does?" "Then we'll ask you directly, and you'll have the right to say no." She looked at Tanner. He was watching her with the exhausted, particular attention of a man who's spent too much time in situations where the wrong call was permanent. "You should have said no in Kandahar," he said quietly. "But you didn't." She didn't answer. "Whatever you decide," he continued, "what you did tonight, that was you. Not the army, not the mission, not the unit. That was just you." He shifted slightly against the pillow and winced, then continued anyway. I was conscious for most of it. I heard what they said to you. It doesn't matter. Yeah, it does. His voice didn't change in volume, but something in it did. It matters that you stood there and told that doctor exactly what was happening and he laughed at you. It matters that they tried to walk you out of the room, and it matters that you came back in anyway. He looked at her steadily. You came back in anyway. The monitoring equipment hummed softly. Outside the curtain, the night shift was running at its usual 1 a.m. frequency. Reduced staff, reduced noise, the particular exhausted quiet of a hospital between crises. Get some sleep, Ellie told him. Your team is in the building? Waiting room, Calloway said. 4 of them. Make sure someone checks in with Kimball about the drainage output every 2 hours. If it changes, she glanced at Calloway. Find me. She pulled the curtain aside and stepped back into the corridor. The nursing station at 1:15 a.m. was staffed by 2 people, Donna Reyes, who was at the computer finishing an intake form and systematically ignoring whatever feelings she was having about the last 90 minutes, and a newer tech named Will Sato, who was eating crackers from a vending machine bag and trying to appear uninvested in what was obviously the most interesting shift he'd worked in months. Ellie sat down at the far end of the station and started updating the chart for Bay 3, which was 2 hours behind. She got 4 minutes of silence before Donna appeared beside her. You want to tell me what that was? Donna asked. Tension pneumothorax, second intercostal, midclavicular. It's in the literature. I know what it is. I'm asking what that was. Donna gestured vaguely at the space around Ellie, the corridor, the bay, all of it. That man said your name. Not your name. Something else. Patient was confused. Blast injuries do that. Ellie. She kept typing. Marsh. Donna's voice dropped, and what replaced the charge nurse authority was something more careful. I've been watching you work for 7 months. I always knew you were more than you let on. I just didn't know how much more. She paused. I don't need to know, but I need to know if I'm about to lose you. Ellie stopped typing. She looked at the screen for a moment, at the meaningless administrative data populating fields that had nothing to do with any of this. Not tonight, she said. Donna was quiet. Then, Hale's going to make this into a thing. I know. He called the medical director 45 minutes ago, from inside the bay. He thinks I didn't hear, but I hear everything on this floor. She crossed her arms. He's framing it as a nurse performing unauthorized invasive procedures. He's not leading with the patient survived. He's leading with the liability. Ellie absorbed this without expression. It was the move she'd have anticipated from Hale, not denial of the outcome, because the outcome was standing there breathing in a monitored bay, but reframing. Strip the context. Lead with the credential deficit. Make it about what she wasn't rather than what she'd done. Is the medical director coming in? She asked. In the morning, 7 a.m. That gave her approximately 6 hours. She pulled up a new document on the hospital system. Not a chart, not an intake form, but a plain incident report, the kind that anyone on staff could file at any time, time-stamped by the system at the moment of creation. And she began typing, not defensively, just accurately. Time, observation, stated recommendation, response received, action taken, outcome measured. She wrote it the way she'd been trained to write field reports in a completely different context, sequentially, without editorializing, with the specific data points that would be most difficult to argue with later. Oxygen saturation pre-intervention, 81%. Post-intervention, 95% at 5 minutes. BP recovery documented. She was halfway through when she heard footsteps behind her that she recognized before she turned around. Victor Hale. Not 1 hour later, now. He had someone with him, a man she'd never seen, 50s, jacket over a button-down, the careful grooming of someone who'd been woken up and pulled together quickly. The medical director, presumably, ahead of schedule, which meant Hale had called him not 45 minutes ago, but earlier, maybe from inside the bay, maybe from the moment it became clear that the intervention had worked. Dr. Samuels, Donna said from somewhere behind Ellie, with the careful tone of a woman choosing her battles. We weren't expecting you until morning. I was in the area. Samuels looked at Ellie with the measured, professionally neutral expression of an administrator who has been told a story on the way over and is now forming a first impression. "You're Marsh?" "Yes." "I understand there was an incident tonight. There was a patient with a tension pneumothorax who needed needle decompression before attempted intubation. I identified it and performed the procedure. The patient is currently stable in Bay 2. She performed an invasive procedure without physician authorization," Hale said. There it was. Flat, immediate, already in the record by virtue of being spoken in front of witnesses. She accessed a monitored patient against my explicit instruction. She was physically in the process of being removed from the bay when she saved him. Kimball's voice came from behind them. Everyone turned. Jared Kimball was standing at the corridor entrance with a tablet in his hand, still in his trauma gloves, which he hadn't taken off because he'd apparently come directly from completing the chest tube drainage check. He looked like he regretted speaking the moment the words were out, which was a particular expression that Ellie recognized, a person who decided to be braver than was comfortable for them. The patient would not have survived intubation without prior decompression, Kimball continued. He was talking to Samuels, not to Hale, which was a careful choice. That's not conjecture. The pleural pressure at the time of intervention was sufficient to cause cardiac tamponade under positive pressure ventilation. Nurse Marsh identified the deviation and contraindicated intubation before it was attempted. Her assessment was correct. "You're a second-year resident," Hale said. His voice had gone quiet again. "Yes, sir." Kimball met his eyes for about 2 seconds longer than Ellie would have expected. "And I've reviewed the timeline on the monitor printout. The intervention took 40 seconds from needle insertion to measurable saturation improvement. That's not something you improvise." The corridor was quiet enough that the monitors from Bay 2 were audible through the wall. Samuels was looking at Ellie with a different quality of attention than he'd arrived with. "Where did you train?" he asked. It was a simple question, the kind of question she'd been navigating carefully for 7 months. She'd had her answer prepared in several variations, calibrated for different levels of follow-up, rehearsed enough that it came out naturally under normal circumstances. But Calloway was in Bay 2. And Tanner had said her name, her real name, the name she'd set down 2 years ago and tried to walk away from, out loud, in front of a room full of hospital staff. And the 2 words Sierra Kilo were sitting somewhere in at least 6 people's short-term memory. And she was tired. She was tired of the architecture of the things she'd built around herself, the careful smallness, the deliberately missed opportunities, the letting herself be talked over and passed over and pointed at with the accumulated frustration of someone who'd learned that being invisible was the only version of peace she could afford. She looked at Samuels. She looked at Hale. She said, "I'll answer that in the morning, in writing, with documentation. Ms. Marsh, I've been on shift since 11:15. I have 4 hours left. I'll complete my shift and I'll be available for any formal inquiry at 7 a.m. She stood up from the station and picked up her tablet. "But I'd suggest that any preliminary framing of tonight's events waits for the full monitor record, the field notes I've just filed, and the accounts of everyone present in that bay, including the 2 federal agents currently sitting with Commander Tanner." Samuels went still. Hale's expression changed. "Federal agents," Samuels said. "Defense intelligence. They arrived shortly after the commander was admitted." She looked at Hale. "The patient, Commander Tanner, was injured in what may be a deliberate act against a military installation. That makes this a federal matter, which means anything that happened in that trauma bay tonight is going to be reviewed by people who are considerably less interested in institutional liability than they are in what actually occurred and why." She tucked her tablet under her arm. "I'll see you at 7. She walked away from them. She didn't walk fast. She didn't look back. She turned the corner toward the supply corridor, and once she was out of their sightline, she stopped and put her hand flat against the wall and took a breath. Just one. It came out uneven at the edges, which annoyed her because she'd wanted it to be cleaner. Her phone buzzed. Unknown number. She looked at it for a moment, then answered. "Marsh," Calloway's voice. "We have a problem." "What kind?" "The contracting officer we mentioned, the one who last had the manifest." A pause that had texture in it. "He showed up 40 minutes ago at St. Clair Memorial. That's the hospital on the south side of the city. He's been admitted with a cardiac event." She processed this. "Natural?" "That's what we're trying to determine, but he had a phone on him, locked. And before he lost consciousness, He apparently said one thing to the paramedics. Another pause. He said they already know about the nurse. The supply corridor was silent around her. She looked at the wall. At the scuff marks and the anonymous beige paint and the supply cart someone had left at a slight angle that had been bothering her since Tuesday. "What nurse?" she said, even though she already knew the answer, could feel it settling into place with the cold precision of a thing that has been true for longer than you realized. "We don't know yet," Calloway said, "but given what happened in your trauma bay tonight, given the fact that Tanner identified you, there's a possibility that whoever is behind this already knows you're here, and what you used to be." Outside the supply corridor, the hospital hummed along with its 1 a.m. rhythms, indifferent and institutional, the sound of a building that doesn't know what's happening inside its own walls. Ellie Marsh stood in the corridor and understood, with the specific clarity of someone who had spent 2 years trying to outrun a version of herself, that the distance between that version and this one had just collapsed entirely. She hung up the phone and stood in the supply corridor for exactly 7 seconds. She counted them, an old habit, the kind that gets drilled into you when 7 seconds is the difference between a decision and a reaction. And then she moved, not toward the nursing station, not toward Hale's office or Samuel's or any of the institutional machinery that had just shifted into a higher gear around her. She moved toward Bay 2, and she moved with the kind of purpose that doesn't look like urgency from the outside, which was also an old habit. Calloway was standing when she came through the curtain. Okafor was on his phone in the corner. Tanner was awake, more awake than 40 minutes ago, the sedation metabolizing faster than the dosage chart would have predicted for a man his size who'd been fighting it since the moment he arrived. "You heard," Calloway said. "You just told me." "No. I mean, did you know? Before tonight. Was there anything in the last few weeks that felt—" "Calloway." She stopped him. "If someone had been watching me, I'd have known. I've been careful." She paused. "But Tanner said my designation out loud in front of 22 people, most of whom have working phones. If whoever is running this operation has any kind of signal monitoring on hospital communications—" "We swept this bay when we arrived," Okafor said, not looking up from his phone. "Clean." "The corridor wasn't swept." Neither of them answered that, which was its own answer. Tanner shifted in the bed, pushing himself more upright than was advisable, given what was draining from his chest wall into a collection chamber on the bedside rack. "Marsh, sit down for a second." "I'd rather stand." "I know. Sit down anyway." She sat, pulled the visitor's chair to the side of the bed and sat in it with her elbows on her knees, which was not a posture she'd have used in front of anyone at Hargrove in 7 months, but which came back to her now with the ease of something that had never actually left. "The contracting officer's name is Gerald Paskey," Tanner said. He kept his voice low and even, the voice of a man who has learned to brief under physical duress. "He's been in procurement for 11 years, clean record until about 18 months ago, when he started signing off on equipment orders that bypassed the standard 3-vendor comparison. Small stuff at first, then larger." He took a careful breath around the chest tube. "He's not the top. He's a link. But he's the link closest to the physical evidence, which is why someone just tried to kill him." "Cardiac event could be natural," Ellie said. "Paskey is 43 and ran a half marathon in April," Okafor said. "His last physical was 8 weeks ago. All clear." She accepted this without expression. "What's on the phone?" "That's the question." Calloway moved to the curtain, checked the corridor, came back. "Locked device, military-grade encryption on the chassis. Our techs can crack it, but not here. We'd need to get it to the field office, which is 40 minutes from St. Clair, and moving it means a chain of custody issue if this goes to prosecution." "Can someone from the field office come here?" "Already in transit. 90 minutes out, coming from Colorado Springs." He looked at her. "The problem isn't the phone. The problem is the 48-hour window Tanner told you about just got significantly shorter. If Paskey knew they were watching him, if that's why he said what he said to the paramedics, then whoever is above him in this knows the timeline has collapsed." Tanner looked at her. "There's a second copy of the manifest." She looked back at him. "Paskey kept a physical backup. We know this because 3 weeks ago, he told a colleague he had insurance. Those were his exact words. Insurance. We've been trying to locate it since then." He held her eyes. "The colleague he told was a woman named Sandra Voigt. She's a logistics coordinator at the same installation. She came to us voluntarily 2 weeks ago, which is how we know as much as we know. Another careful breath. Voigt said Pasquet kept the backup off-site. Not at his home, not at his office. Somewhere in the city. Then find it, Ellie said. We're trying. But Voigt also said something else. He paused. She said Pasquet mentioned the backup was with someone he trusted, someone who didn't know what they were holding. The monitoring equipment kept its steady rhythm. The drainage chamber registered the faint, periodic pulse of fluid that told her Tanner's lung was doing what it was supposed to be doing, slowly, imperfectly, the way bodies heal when you've given them back enough room to try. What does that mean, she asked, though something in the back of her mind had already begun assembling a structure around the answer. It means Pasquet gave something to someone, a person, not a storage facility, for safekeeping. Someone outside the installation, outside the investigation, someone he believed was completely removed from all of this. Calloway watched her carefully. We've been working through his personal contacts for the last 3 weeks. Family, friends, former colleagues. We've been through most of them. Most, she said. There are gaps. People we haven't been able to reach yet. One of them. He stopped, and she could see him making a decision about how to say the next thing. One of them is a woman named Dara Hollis. She's a civilian nurse, mid-30s. Used to work at a military installation clinic in New Mexico about 4 years ago. She and Pasquet overlapped by about 18 months. Ellie was quiet. She left that position, moved to Tulsa, got a job at a local hospital. Calloway kept his voice neutral. We haven't been able to reach her because she doesn't appear to have a current address on file with anyone. Her employer lists a P.O. box. Which hospital? Ellie asked. Calloway looked at her for a moment. We don't know yet. Our database search is running. She looked at Tanner. Tanner looked at the ceiling. This Hollis woman, Ellie said slowly. Is she a suspect? No. We think she's exactly what Pasquet told Voigt, someone he trusted who doesn't know what she's carrying. Calloway's voice had shifted into the careful register of a man who is being precise on purpose. We need to find her before whoever sent someone after Pasquet does. Because if they can't get the phone, they'll go to the backup, and to whoever has it. The curtain moved slightly in the recycled hospital air. Somewhere down the corridor, a phone rang twice and stopped. Ellie stood up. She was not going to say what she was thinking, which was that the architecture of the last 7 months, the P.O. box, the carefully maintained civilian identity, the hospital that nobody at the DI had apparently connected to Dara Hollis yet, had just become both a liability and possibly the only leverage anyone had left. Find your database results, she said to Calloway. I'll be at the nursing station. She went back out into the corridor. By 2 a.m., the hospital had settled into its deep night register. Skeleton crew, reduced overhead lighting in the non-critical areas, the particular quality of silence that isn't really silence, but is instead the absence of the administrative noise that fills the building during the day. Ellie worked through her remaining chart obligations with mechanical efficiency, documenting, filing, updating, performing the ordinary labor of the shift with enough surface-level normalcy that anyone glancing at the station would see a nurse finishing her paperwork. Underneath that, she was thinking very fast. Gerald Pasquet. She ran the name against her memory and found nothing. No face, no interaction, no overlap. If he'd given something to Dara Hollis for safekeeping, he'd done it through a channel she didn't remember, which meant it was possible, more than possible, that she was holding something she'd received as an ordinary piece of mail or a package, or even just a casual exchange, the kind that doesn't register because it's designed not to. She thought about the last 7 months. She thought about what had arrived at her P.O. box during that time. She thought about a padded envelope that had shown up 11 weeks ago, no return address, her alias on the front in handwriting she hadn't recognized, containing what appeared to be a USB drive with a sticky note that said, "Hold on to this for me. G and nothing else." She had put it in the locked box in her apartment closet with the 3 other things she kept locked. Her service pistol, her discharge papers, and the photograph she didn't look at anymore. She had not thought about it again until right now. Her hands were steady on the keyboard. She kept typing. Calloway appeared at the edge of the station at 2:17 a.m. I didn't say anything, just stood there with his phone in his hand and an expression that confirmed what she'd already assembled. You found her, Ellie said without looking up. Hargrove Medical Center, night shift, 7 months. He paused. It's you. She stopped typing. She looked at her hands on the keyboard for a moment. There's something in my apartment, she said. A USB drive. I received it about 11 weeks ago. No return address. Initials I didn't connect to anyone. Calloway sat down in the chair across from her with the careful movement of a man who is working very hard to stay calm. Where's the apartment? 12 minutes from here. I can get it on my break. I'll send Okafor with you. I don't need Marsh. His voice was quiet, but had an edge that hadn't been there before. Someone already tried to kill Pask. They may or may not know that the backup exists. If they find out it's in a civilian apartment held by someone who just spent the last 3 hours becoming very visible. He didn't finish it, which was more effective than finishing it. She thought about the trauma bay, Tanner's voice, Sierra Kilo, Medic Marsh in front of 22 people. Fine, she said, but I go in alone. He waits outside. Calloway opened his mouth. Non-negotiable, she said. He closed his mouth, then nodded once. The break room was empty at 2:30. She told Donna she needed 20 minutes, ate half a granola bar she didn't want, drank water she also didn't particularly want, and spent the remaining time sitting with the specific quality of stillness that people who've been in combat zones learn, because the alternative is burning through your adrenaline before you need it. She was thinking about Hale. She was thinking about 7 a.m. and Samuels and whatever Hale was building in his office right now, because she was certain he was still in the building, certain he was not sleeping, certain that the combination of institutional threat and personal humiliation was keeping him at his desk, drafting the kind of documentation that would look very reasonable to a medical board that didn't know the full context. The full context being a patient who was alive and a physician who'd been about to kill him. She was thinking about what Kimball had done, standing in that corridor with his trauma gloves still on, saying she saved him in front of the medical director. That had taken something. She didn't know Kimball well enough to know if he'd regret it. She was thinking about the USB drive in the locked box in her closet, and the fact that for 11 weeks she'd been carrying evidence in a federal investigation without knowing it, and what that meant for the careful, constructed anonymity she'd spent 2 years building. She finished the water. She went back to the nursing station, told Donna she was taking her scheduled break at 3 a.m. to step out for air, and went to find Okafor. The drive to her apartment took 9 minutes because there was no traffic. Okafor drove, which she allowed because arguing about it would have taken longer than the drive. He parked outside the building and she went in alone as agreed up the stairs. She never used the elevator, another old habit, and into the apartment that contained almost nothing personal because she'd never fully decided whether she was staying. The locked box was on the top shelf of the closet, behind a folded blanket. She unlocked it with the combination that she had never written down anywhere. The USB drive was inside, in the same padded envelope, the sticky note still attached. Hold on to this for me. G. She stared at it for 3 seconds. Then she put it in her jacket pocket, relocked the box, replaced the blanket, and left. Okafor looked at her when she got back in the car. She held up the envelope. He pulled out his phone and typed a message, presumably to Calloway, and they drove back to Hargrove without speaking, which suited her fine. It was 3:24 a.m. when they got back to the hospital, and the first thing she noticed was that there were 2 additional vehicles in the parking structure that hadn't been there when she left. Dark SUVs, government plates, the kind of configuration that meant the situation had expanded while she was gone. She was fairly certain was the administrator's conference room on the 2nd floor we're on. The third thing she noticed was Victor Hale, standing just inside the ambulance bay entrance with his arms crossed and his phone in his hand, looking at her as she walked through the door with the expression of a man who has been waiting and who has used the waiting time productively. Ms. Marsh, he said, you left the premises during your shift. I took my scheduled break. You left the building. There's no policy against stepping out during a break. There's a policy against abandoning patient responsibilities. He uncrossed his arms. He was holding the phone loosely, and she could see it was recording. She noted this without reacting to it. And there's a more significant policy against what I've spent the last hour documenting. She looked at the phone. Is that running? I want a clear record. Then you should know that I'm going to respond to any formal inquiry in writing, with union representation present, as is my right under the employee handbook you've apparently been reading tonight. She moved to step past him. He stepped sideways, not blocking her exactly, but not clearing the path. I've spoken with Dr. Samuels. We agree that pending a formal review, you should be suspended from patient care duties effective immediately. The ambulance bay was quiet around them. The overhead lights buzzed at their usual low frequency. Then put it in writing and give me a copy, she said. Right now, in front of your recording, I want to be clear. I performed a clinically indicated procedure on a critically deteriorating patient after the attending physician failed to identify a life-threatening complication. The patient survived. All of that is documented in the system with accurate timestamps. She looked at him steadily. Whatever you file tonight, that will still be true in the morning. What will also be true, Hale said, and his voice had dropped into that specific register she'd been on the receiving end of since her second week, the one he deployed when he'd decided the gloves were off, is that I've requested your full personnel file from HR, and I've asked them to include the background check documentation, including the inconsistencies. He paused. There are gaps in your training history, Miss Marsh, significant ones. The licensing board is going to have questions. She looked at him. He held her eyes. Who are you? He asked, and it was the second time he'd asked her that tonight, but this time it had a different shape. Not bewilderment, but threat. Because you are not what you put on that application. From somewhere above them, in the conference room on the second floor, she could hear voices. More than two. The specific quality of a meeting that has already started. No, she said. I'm not. She walked past him. But it. The conference room had 4 people in it when Calloway brought her up at 3:45 a.m. Samuels, who looked like he'd made a series of decisions in the last 2 hours that he was still working out the implications of. A woman named Agent Reyes from the DI field office, who'd arrived from Colorado Springs faster than projected and was running on coffee and professional urgency. And 2 people Ellie didn't recognize who had the particular institutional bearing of people who operate a level or 2 above where the conversation normally happens. She set the padded envelope on the conference table. Nobody touched it immediately. We need to verify the contents before we can confirm this is what we're looking for, Agent Reyes said. She had her own laptop open and a portable forensic kit on the table beside it. Do you have any idea what's on it? No. Did you open the envelope when you received it? Yes. I saw the drive and I didn't plug it in. She paused. I've spent 2 years being careful about what I plug into what. Reyes looked at her briefly with an expression that was almost, not quite, a small and exhausted form of respect. She opened the envelope using a gloved hand, extracted the drive, connected it through an isolated forensic reader to her laptop, and began running what Ellie understood from context was a controlled preview scan rather than a full access read. The room waited. Samuels cleared his throat. Ms. Marsh, I want to be clear that the matters being discussed in this room are separate from the hospital's inquiry into tonight's clinical events. I understand. I also want to be clear that whatever your background turns out to be, the inquiry will proceed according to standard process. I wouldn't expect otherwise. He looked at her for a moment. Hale is downstairs filing a formal complaint. He's been on the phone with 2 board members. I know. You don't seem particularly concerned. I'm concerned about several things right now. That one is on the list. She looked at Reyes. How long for the preview? 4 minutes. Reyes was watching her screen. Maybe 3. One of the people Ellie didn't know, a compact woman with close-cropped silver hair who had not introduced herself and who had not stopped watching Ellie since she'd walked in, spoke for the first time. Walk me through what happened in the trauma bay. Start from when the patient arrived. Ellie walked her through it, clinically, sequentially, without dramatizing any of it. The tracheal deviation, the contraindication, the intervention, the outcome. The woman listened without interrupting and without changing her expression, which was the expression of someone who is constructing a picture and doesn't want their process contaminated by visual feedback from the subject. When Ellie finished, the woman said, "And the commander recognized you?" "Yes." "From where?" Ellie looked at her. "That's classified. I have clearance." "Then you can pull the file." Ellie held her gaze without hostility, without apology. "I'm not going to brief my service record to someone who hasn't told me their name." The silver-haired woman was quiet for a moment. Then the corner of her mouth moved. "Colonel Yvette Strand, DIA Special Programs. Retired." She paused. "Technically retired. The deployment was in the Eastern Region, 2021. I was a combat medic attached to a special operations element. Commander Tanner was part of a joint team we supported during an extraction operation. Ellie kept her voice level. I can't give you more than that without documentation of your current clearance status, Colonel. I'm sorry. That's the right answer, Strand said, in the tone of someone who'd been checking. Got it, Reyes said from across the table. The room shifted. Reyes turned her laptop to face the table, and what was on the screen was a directory structure. Files, dozens of them, organized by date and by procurement identifier, and across the top of the directory, visible without opening anything, a label that read Vantage Supply, Audit Trail, Do Not Circulate, GKP, Gerald K. Paskey. Strand leaned forward. For the first time since Ellie had come into the room, she looked like she was feeling something beyond professional calculation. That's the full audit trail, she said quietly. That's everything. 18 months of procurement records, Reyes confirmed. Every order, every modification, every signature bypass. This is the complete chain. She looked up. This is enough to indict. The room did something that rooms do at certain moments. It seemed to contract slightly, all the separate energies in it pulling toward a single point. Calloway exhaled through his nose. Okafor, standing near the door, went still. Ellie looked at the screen and felt something strange. Not triumph, which was what the moment seemed to be calling for, but something more complicated and less satisfying. The feeling of a thing that has been moving in darkness for a long time arriving suddenly in the light, and the light being just as brutal as the dark was, in its own way. How long before you can move on this? She asked. Federal warrant requires authorization from... Reyes stopped. Her phone was buzzing. She looked at it, and her expression changed in a way that silenced the room before she'd said a word. What? Strand said. St. Clair Memorial. Reyes looked up. Paskey is dead. Nobody spoke. They're calling it cardiac arrest. He arrested twice. They couldn't bring him back. She was already typing with one hand. Time of death, 3:41 a.m. 3:41. 14 minutes ago, while Ellie had been walking Strand through the trauma bay, Calloway moved to Reyes' side. Any witnesses to the arrest? Anyone in the room? That's what they're trying to determine. Strand stood up. She was already reaching for her phone with the focused efficiency of someone shifting from assessment to action. If they move to cover the rest of the chain tonight, we have a window of maybe... Her phone lit up before she could finish the sentence. She looked at it. Her expression did something that Ellie had not seen it do in the 40 minutes since they'd been in this room together. It went uncertain, just briefly, just for a moment. But certain people have faces that aren't built for uncertainty, and on those faces, even a moment of it reads like a crack across stone. There's a second team, Strand said. What? Calloway turned. Someone just attempted access to the DI field server in Colorado Springs 40 minutes ago while we were in transit. She held up the phone so Calloway could see the alert. They weren't trying to steal data, they were trying to delete a specific file set. She looked across the table, and when her eyes landed on Ellie, they had a new quality in them, something between gravity and warning. The file set was the background documentation on Operation Sierra Kilo. Ellie heard that. She felt it land somewhere in her chest cavity with a weight that was disproportionate to the number of words it took to say. Sierra Kilo. Her operation, her record. The document that, if deleted, would reduce her service history to what appeared on her civilian nursing application, which was not enough, which had never been intended to be enough, which was a construction designed for invisibility rather than defense. Someone is trying to erase you, Strand said, not just the investigation. You specifically. Across the conference table, Samuels was looking at Ellie with an expression she didn't have time to analyze. Somewhere below them, in the hospital she'd spent 7 months being invisible in, Victor Hale was downstairs filing paperwork that would, in the absence of her military record, tell a very convincing and very incomplete story about an unqualified nurse who had overstepped catastrophically. And the USB drive sat on the table between all of them, holding 18 months of evidence that was worth killing for. Her phone buzzed. She looked at it. Unknown number. Not Calloway's. She had his number now. She answered. The voice on the other end was not a voice she recognized, and it was not trying to be reassuring, and it said 4 words before the line went dead. We know you're there. She put the phone down on the conference table face up, which was a deliberate choice, not hiding it, making it part of the room's information. That was a warning, Strand said. Not a question. Or a test, Ellie said, to see if I'd run. Would you? She looked at the USB drive on the table, at Reyes's laptop with the directory still open, at the window that showed the parking structure and the dark SUVs and the specific geometry of a situation that had moved, in the span of one shift, from something she'd been avoiding for 2 years to something that had arrived anyway, with or without her cooperation. No, she said. Strand nodded once, like that was the correct answer, and also the only one she'd have known what to do with. Calloway. Lock down this floor. I want the stairwells covered, and I want Tanner's Bay to have 2 people outside the curtain, not 1. She was already moving toward the door. Reyes, the drive goes into the forensic bag right now and doesn't come out until we have chain of custody documentation signed by 3 people in this room. Already bagging it, Reyes said. Marsh. Strand stopped at the door and turned. You're going to need to tell me about Sierra Kilo. The full version. Not the file. I need it from you, in your words right now, because whatever they're trying to erase is the same thing that explains why you knew what you knew in that trauma bay, and I need to be able to defend the sequence of events tonight before the medical board convenes at 7 a.m. Ellie looked at Samuels, who was sitting very still with the expression of a man who had arrived thinking he was handling a nursing misconduct issue, and now found himself in the geographic center of something considerably larger. You should probably stay for this, she told him. He nodded, slowly, the nod of someone who understands that the context of a situation has changed, and that the version of events he arrived with is no longer the relevant one. She sat down. She talked. Sierra Kilo was a joint extraction operation in March of 2021, 12 days into what was supposed to be a 72-hour support rotation for a special operations element, working a target in a mountainous region that she wasn't going to name specifically, in a country she also wasn't going to name specifically, and Strand could fill in those gaps from the classified appendix whenever she pulled the file. The relevant facts were these. The extraction went wrong in the 4th hour because of bad intelligence about a secondary position, a vehicle was hit, and 3 soldiers were critically wounded in a location that was 40 minutes from the nearest viable landing zone and actively contested. She had been the senior medical personnel on the ground. The element's own medic had been the first casualty. She had triaged 3 men in order of survivability, made a decision about treatment priority that deviated from standard protocol in a way that a subsequent investigation would describe as inconsistent with established field medicine guidelines, and all 3 of them had survived. The deviation, treating a penetrating chest wound before a more accessible but less immediately critical abdominal injury, was the kind of call that looks wrong on paper and right in the physical reality of a man who is going to stop breathing before he loses enough blood to die from the abdominal wound. She had known that. She had made the call. She had been correct. The investigation had not been about whether she was correct. It had been about something else. And the something else was the kind of institutional politics that grows in the space between what actually happened and what the official report needs to say for reasons that have nothing to do with the people who were bleeding in the dirt. There had been a senior officer present whose positioning during the incident didn't align with where his report said he was. Her field notes, which she'd documented as trained, contradicted that report. The investigation had focused on her deviation from protocol as a way of making her the central issue rather than the discrepancy in the senior officer's account. She had been cleared. Technically. The language of the clearance was the language of someone who was being told to stop talking about what she'd seen. No adverse finding against Sergeant Marsh, case closed, record sealed. She'd left the Army 4 months later, not because she'd been pushed out, but because staying had required a particular kind of accommodation with the official version of events that she'd found she couldn't sustain. She told all of this to the room in about 12 minutes, without editorializing, and when she was done, the room was quiet for a moment. Samuels looked like a man resorting a significant amount of information. Strand looked like a woman who had suspected most of this and was now confirming the shape of it. The senior officer, she said. Name. That's in the sealed record. I know it's in the sealed record. I'm asking you. Ellie looked at her. Colonel Marcus Red. He was attached to a procurement oversight committee 6 months after the incident. Strand went still. Procurement oversight, Calloway said from the doorway. Yes, Strand and Calloway exchanged a look that moved fast and carried a lot, the look of two people who have been building a picture for months and have just been handed a piece they didn't know they were missing. Red is a name that appears in 3 of the modified procurement orders, Reyes said quietly from behind her laptop. I didn't flag it because his role was listed as secondary authorizer, oversight, not primary signature. She looked up. He'd have been invisible in a standard read of the documents. He was supposed to be, Ellie said. The room rearranged itself around this information. She could feel it happening, the collective recalibration of everyone's model of the situation, the moment when something that looked like a procurement fraud case revealed a second layer that was also, and perhaps primarily, about the systematic management of a witness who had inconvenient field notes. They didn't just want the manifest, Strand said, thinking aloud. Red's been trying to close the Sierra Kilo discrepancy for 3 years. Pasque was a tool, someone Red had leverage on, someone he used to route the procurement modifications. But Pasque got nervous and made a backup, and the backup ended up with you, and then tonight Tanner said your name out loud in a room full of people. And suddenly the woman Red has spent 3 years keeping buried as a footnote in a sealed file is standing in a hospital in Tulsa with evidence that connects the procurement fraud directly to him. Ellie said nothing. She was looking at the window. He's not just trying to cover the fraud, Strand continued. He's trying to eliminate the one person whose documented account can place him somewhere he wasn't supposed to be in 2021. The procurement case is the mechanism. You were always the target. The fluorescent light above the conference table buzzed briefly, then settled. Where's Red now? Ellie asked. Strand looked at Calloway. Calloway looked at his phone. Colorado Springs, he said. He's been based at the installation there for 14 months, which puts him 40 minutes from the field server that was accessed tonight. Can you place him at the server access? Not yet, but if the access was made using credentials we can trace. Calloway was already on his phone, stepping toward the corridor. Ellie looked at Strand. He's going to move tonight. If he knows the drive has been found, if he knows I'm in this building with federal agents, he's going to move on whatever he can still reach before morning. She paused. What can he still reach? Strand didn't answer immediately, which was itself an answer. Sandra Voigt, Ellie said, the logistics coordinator, the one who came to you voluntarily. She's in protective custody. Since when? Since yesterday evening. But something in Strand's voice had shifted by a fraction. Has anyone confirmed contact with her in the last 3 hours? Strand reached for her phone. The confirmation came back in 4 minutes, which was 3 minutes and 50 seconds longer than it should have taken if everything was in order. And what the confirmation said was that the last verified contact with Sandra Voigt had been at 11:30 p.m., which was 45 minutes before Tanner arrived at Hargrove, which meant the timeline of the evening had a gap in it that nobody had been looking at because they'd been looking at everything else. Ellie stood in the hallway outside the conference room while Strand worked the phone with the focused urgency of someone who has just discovered that the situation is worse than the worst-case model accounted for. Calloway was at the other end of this corridor. Okafor was on a separate call. The 2 people whose names she still didn't know had moved to the stairwell. The hospital below them was quiet. She thought about Voigt, a woman she'd never met, a logistics coordinator who'd looked at something wrong and made the decision to report it. The kind of decision that takes more than most people realize because you can't fully know what it's going to cost you before you make it. She thought about the specific loneliness of being the person who said something when saying something was dangerous, and what it meant that she might currently be unaccounted for in the middle of the night, while everyone who was supposed to be protecting her was dealing with events at a hospital 40 minutes away. She went back into the conference room. I need Tanner, she said to Reyes, who was still at the laptop. He's in the monitored bay. He shouldn't. I'm not asking for a consult. I'm asking what he knows about Voigt's protective arrangement and who was running it. Reyes looked at the door, then back at her screen. The arrangement was coordinated through the Colorado Springs office, Agent Paulson's team. Is Paulson reachable? Strand's trying him now. Reyes glanced up. His last check-in was at midnight. That landed. Ellie went to the door. Keep the drive in this room with at least 2 people in physical contact with it at all times. She looked at Reyes. If anything changes on the Voigt situation, find me immediately. Where are you going? Downstairs. I still have a shift to finish. She found Kimball at the nursing station at 4:10 a.m. updating a chart with the slightly dazed efficiency of a second-year resident running on insufficient sleep and a surplus of adrenaline. He looked up when she sat down beside him, and the look he gave her was the look of someone who had been thinking about a decision they made several hours ago and hadn't fully resolved whether it was the right one. "How's your night going?" he said. "Eventful." She pulled up the Tanner chart. "Drainage output?" "Stable. 30 cc's over the last 2 hours, no air leak, lung is re-expanding on the last film." He paused. "He keeps asking about you." "I know." She was reading the chart. "Kimball." "Yeah. What you did in the corridor with Samuels." She kept her eyes on the screen. "You didn't have to do that." "I know. Hale's going to make your next 6 months uncomfortable." "He was already making my next 6 months uncomfortable." A pause. "I've been watching him override nurses and residents for 2 years. I've been watching him be wrong and be loud about it and have nobody say anything. And you were right, in real time, in front of everyone, and he still tried to walk you out." He was quiet for a moment. "I don't know what your deal is. I don't know what that guy said to you or why those federal agents are here. But I know what I saw, and I know what the monitor printout shows. And I wasn't going to stand in the corridor and pretend I didn't." She looked at him. He was staring at his chart. "Thank you," she said. He nodded once, the nod of someone who doesn't know what to do with gratitude and has decided that acknowledging it briefly is safer than expanding on it. She finished reading the chart and stood up. "Marsh." He was still looking at his clipboard. "Whatever's happening upstairs, is it going to be okay?" She thought about Voight, about Red, about the gap in the timeline that nobody had caught until 11 minutes ago. "I don't know," she said, which was the true answer, and probably not the useful one. She walked away from the station. Thus, Victor Hale emerged from his office at 4:30 a.m. She knew he would. She had been fairly certain since around 3 a.m. that he would not be able to sustain the strategy of waiting for morning, that the combination of uncertainty about what was happening on the second floor, the presence of federal agents, and the particular corrosive anxiety of a man who has built his professional identity on being the authority in every room he enters would push him out before dawn. She had been positioned at the supply station near the corridor entrance when he came out, which meant she saw him before he saw her, which was a small advantage she had not engineered deliberately, but accepted without apology. He was carrying a folder. The folder was the kind of physical performance that certain people use when they want to signal that they have done significant work. Thick, tabbed, the evidence of hours of preparation. She recognized the performance because she'd been on the receiving end of its institutional equivalent before, in rooms with different furniture. He saw her and walked toward her without hesitation, which meant he had a script prepared and had decided to run it. "The medical director has agreed to convene a preliminary review at 6:30 a.m., he said. "That's 30 minutes before the formal board inquiry. The purpose of the preliminary review is to determine whether you should be allowed to remain on premises during the formal process." He held the folder. "I've prepared a summary of tonight's events that I'll be presenting. I want to give you the opportunity to see it before I submit it." She looked at the folder. She thought about Strand upstairs, working the phone. She thought about Reyes with the drive. She thought about the 4 words from an unknown number. "We know you're there." And the specific quality of a threat that is designed to make you feel that stillness is the same thing as safety. "Dr. Hale," she said. He waited. "Do you know what a tension pneumothorax does to cardiac output if it's not decompressed before positive pressure ventilation is applied?" He blinked. "That's not... I'm asking you, specifically, not rhetorically. What happens to cardiac output?" A pause. The mediastinal shift compromises venous return. And if venous return drops far enough under positive pressure, then..." He stopped. "Then the heart has nothing to pump with," she said, "and it stops. And the patient dies. And the time between applying positive pressure and cardiac arrest in a tension pneumo at that stage is approximately 90 seconds to 2 minutes, depending on the patient's underlying cardiac reserve." She looked at him without heat, without satisfaction, with the flat precision she'd had since the moment she'd decided not to be small in this building anymore. "Commander Tanner's last recorded cardiac event before I intervened was a transient arrhythmia at..." She checked the timestamp she'd memorized from the chart. 11:51 p.m. "You reached for the laryngoscope at 11:53 p.m. I performed needle decompression at 11:54 p.m. His saturation began recovering at 11:54:43 p.m. She paused. That's the timeline. You can verify every second of it from the monitor log. Hale was looking at her with an expression she hadn't seen on him before. Not anger, not calculation. Something that might, in a different man, have been the beginning of genuine discomfort with a version of events he could not actually argue with. Whatever you put in that folder, she said, the monitor log is already in the system with those timestamps. Kimball's account is already on record, and in approximately 2 hours, the people on the second floor of this building are going to submit a parallel documentation of this evening's events to a federal oversight body that outranks your medical board. She let that settle for exactly 2 seconds. I'd suggest you read what you've written very carefully before you submit it, because everything in it is going to be read by people who have access to the actual sequence of events, and anything that doesn't match that sequence is going to look like something other than a clinical concern. He held the folder for a moment. Then, without saying anything, he turned and walked back toward his office. She watched him go. She did not feel what she'd expected to feel, which was something like relief or release, or the specific satisfaction of a thing resolved. What she felt instead was closer to exhaustion, the kind that comes not from physical depletion, but from the sustained effort of being one thing while everyone around you has decided you're something else. She turned back toward the nursing station. Her phone buzzed. Strand. We found Voight, Strand said before Ellie could speak. Where? She moved herself, without telling her handler, checked out of the hotel at 2 a.m. and took a cab to a friend's address. A pause. She's safe. She panicked and didn't tell anyone she was moving, which is a problem, but she's physically safe. Ellie let out a breath. The other thing, Strand said, and her voice changed register in a way that pulled Ellie's attention back to full alert. Calloway got into the server access logs from Colorado Springs. The credentials used to attempt the Sierra Kilo file deletion belonged to a lieutenant colonel on the installation's administrative staff. Name of Gavin Pruitt. I don't know that name. You wouldn't. He's been Red's administrative liaison for 2 years. Everything Red couldn't sign himself went through Pruitt. A pause. Pruitt attempted the deletion from a terminal on the installation at 1:17 a.m. We have the login, the timestamp, and the access attempt record. What we don't have yet is Red physically placing the order. But Pruitt gives you the chain. Pruitt gives us the chain if he talks. And right now Pruitt doesn't know we have the access log, which means we have a window of maybe a few hours before someone tells him, Ellie said. Yes. She thought about the architecture of the thing. Red had insulated himself. He almost always had. The kind of man who built distance between himself and any given action as a matter of structural habit. Paskey was dead. Pruitt had taken the action but didn't know he'd been traced. The procurement records on the drive were documented but required Paskey's testimony to fully close the evidentiary loop, and Paskey was no longer available. What does Red not know? She asked. A pause. What do you mean? He knows about the drive because he knows about Paskey's backup, or he suspected it existed, which is why he needed Paskey gone. He knows about me because Tanner identified me. He knows the Colorado Springs file deletion failed because the server would have returned an error. She was thinking out loud now, running the gaps. But does he know about Voight's voluntary disclosure? Does he know what she told you specifically? We kept Voight's identity compartmentalized. The only people who know she came to us are on my team and Strand's. So he doesn't know the scope of what you already have. Presumably not. Then he doesn't know that the procurement records on the drive connect to the Sierra Kilo timeline, because that connection requires knowing what Voight told you about Paskey's communication with her, which you've kept compartmentalized. She paused. He thinks he's managing a procurement fraud exposure. He doesn't know he's already been placed at the center of a 3-year cover-up that's now documented on a drive in a hospital conference room in Tulsa. Strand was quiet for a moment. What are you suggesting? I'm not suggesting anything. She paused. I'm noting that if he knew how much you had, he'd already be moving. And he's apparently not moving, because Calloway said he's still at the installation in Colorado Springs, which means he's waiting to see what Pruitt's access attempt produced before he decides on next steps. And if we contact Pruitt before Red does, then Pruitt finds out he's been caught from you instead of from Red, and a man who just tried to delete classified records and doesn't know you have. The log is not in a strong position to calculate whether staying loyal to Red is worth what's coming. Another silence. That's not nothing, Strand said. No, it's not. She heard Strand moving, the sound of a door, and the low undertone of voices. I'll be downstairs in 10 minutes. Don't go anywhere. The line went quiet. Ellie stood at the supply station in the 4th hour of a night that had stopped being a normal night sometime around 11:47 p.m. And she looked at the corridor, at the fluorescent lights, and the scuff-marked floor, and the ordinary, indifferent infrastructure of a hospital that was still just a hospital underneath all of this. And she thought about what happened next. Pruitt was the link. Pruitt could give them Red, if he chose to, if the calculation landed the right way. The drive was the evidence. Voight was safe. Tanner was stable and recovering with people she trusted outside his bay. The Sierra Kilo file was still intact on the DI server because the deletion had failed. Everything was in place. That was what worried her. She had been in enough situations where everything appeared to be in place to know that in place was not the same as safe, and that the gap between those two states was precisely where the things you hadn't accounted for lived. She pulled up the Tanner chart on the station terminal and checked the 4 a.m. vitals. BP 122/76. SAT 97. Drainage stable. Good numbers. She updated the annotation field, marked the time, filed the note. Then she looked at the ambulance bay entrance camera feed on the secondary monitor at the corner of the station. She had been checking it periodically since 2 a.m., not obsessively, just the way you check a thing that matters without making a ritual of it. At 4:51 a.m., a car pulled into the ambulance bay area and stopped. Not an ambulance. A dark sedan. The kind without distinguishing features. The kind of car you don't notice until you've already decided to notice it. It sat for about 45 seconds without the driver getting out. Then the driver got out. She couldn't get a face from the camera angle, but she could see the build, tall, the movement of someone who carries themselves with the particular habituated authority. Civilian clothes, but the posture of a uniform. He didn't go to the front entrance. He went to the side entrance, the one that led directly to the monitored bays without passing through the main desk. Her hand was already on her phone when the nursing station's internal line rang, and Donna picked it up 2 steps away, and Ellie watched Donna's face go from neutral to something that wasn't quite alarm but was adjacent to it. Donna held out the receiver. "It's for you," she said. "He says he's calling from inside the building." Ellie took the phone. The voice on the other end was calm, measured, with the particular quality of authority that comes from a long time spent in rooms where people waited for you to speak before they moved. "Sergeant Marsh," the voice said, "I think it's time we talk directly. I'm going to make this simple for you. The drive you found tonight, the one your federal friends upstairs are very pleased about, has a password-protected partition that none of their tools have accessed yet. That partition contains something that isn't about Gerald Paskey or procurement contracts. A pause, deliberate and timed. It contains your complete field notes from Sierra Kilo, the originals, the ones that were supposed to have been destroyed. Another pause. I've had them for 3 years. I want you to think about what I could do with them, and what I could do to the people whose names appear in them, before you decide how the next hour goes." She held the phone against her ear and did not move. The nursing station hummed around her. Donna was 3 feet away pretending to review a chart. The monitor feeds cycled their slow rotations on the secondary screen. Everything was exactly as it had been 30 seconds ago, and everything was different. She thought very fast. The field notes from Sierra Kilo, the real ones, the ones she'd written in the forward operating base the night of the extraction, the ones that placed Marcus Red at the wrong position and documented the sequence of decisions that his official report had inverted. She had submitted those notes through the chain of command and then been told, months later, that they had not been retained as part of the final case file. She had assumed destroyed. She had assumed that the machinery of institutional self-protection had simply consumed them. She had not assumed that someone had kept them as a weapon. "Still there?" the voice said. "Yes," she said. "Good. Here's what I want. The drive goes back into the envelope. The envelope goes with you to the side entrance, the one I just came through, and you hand it to me directly. No federal agents, no chain of custody documentation, just the drive, in your hand, in the next 10 minutes. A pause. In exchange, the field notes stay buried. The people whose names are in them, The ones who were where they weren't supposed to be, the ones whose accounts don't match yours, they stay protected. You walk away from all of this clean. New identity if you want it, better than the one you have now. She looked at the ambulance bay camera feed. The sedan was still there. He was inside the building, which meant someone was sitting on that car. And if I don't, she said, then the notes go to 6 different recipients simultaneously, and the people named in them spend the next 2 years defending themselves in a process that will be very public and very damaging regardless of the outcome. His voice hadn't changed in quality or temperature. Some of those people are friends of yours. I've read the notes carefully. I know who matters to you. Tanner. He meant Tanner, whose positioning during the extraction was in her notes, whose decisions she'd documented because documentation was what she did, because she had never known how to be in a situation and not record it accurately. Tanner had done nothing wrong, but being in her notes, being named in a document that was now being characterized as a liability, meant he was a surface the man on the phone could use. 10 minutes, the voice said. Side entrance. The line went quiet. She set the receiver down. Donna was looking at her, not pretending anymore. Go check on Bay 2, Ellie said. Her voice came out even, which was what she needed it to do. Vitals check, drainage log, all of it. Take your time. Donna looked at her for 2 seconds with the expression of a woman who understands that something serious is happening and has decided that the most useful thing she can do is exactly what she's been asked. Then she picked up her tablet and walked toward the bay corridor. Ellie picked up her personal phone and called Calloway. He answered in one ring. There's a man inside the building, she said. He came through the side entrance approximately 4 minutes ago. He just called the nursing station landline. He has the Sierra Kilo field notes, originals or copies, I don't know, and he's using them as leverage to recover the drive. A beat. Red? The voice is consistent with someone who expects to be obeyed. I don't have a confirmation. She paused. He gave me 10 minutes. He wants me at the side entrance alone with the drive. Don't go. I'm not going to the side entrance. She was already moving away from the station, toward the corridor that ran parallel to the main hall, the one that connected the supply wing to the back stairwell, the one she'd mapped in her second week at Hargrove because mapping exits was something she did without deciding to. But I need you to do something right now. The camera on the side entrance. Can Reyes pull the feed? She can pull every feed in the building. I need a face. Whoever he is, he came in through the side entrance, and he's somewhere between there and the monitored bay corridor. That's a limited area. She thought through the layout. Supply wing, connecting hall, or he stopped in one of the alcoves near the service elevator. Check those first. On it. She heard him moving, heard him relay the camera request to someone. Where are you going? To get ahead of him, she said, and ended the call. The service corridor behind the supply wing was not a space that appeared on the visitor map. It was the kind of utilitarian passageway that exists in every large building, wide enough for equipment carts, lit by overhead fluorescents on a motion sensor that took 3 seconds to activate, lined with the unremarkable infrastructure of a building's functional organs. She moved through it with the lights triggering ahead of her and going dark behind, and she was thinking about the drive. The drive was still in the conference room upstairs, in Reyes's forensic bag, which meant the man on the phone had given her 10 minutes to produce something she couldn't physically retrieve in 10 minutes without passing through the second floor. Through Strand, through Calloway's people, through the chain of custody documentation that Strand had ordered the moment the drive went into the bag. He had to know that, which meant the 10-minute window was not a genuine negotiation. It was a pressure instrument designed to make her move before she could think. She stopped at the junction where the service corridor met the alcove near the service elevator. She pressed her back against the wall. She listened. The elevator was running. She could feel it through the wall, the low mechanical vibration of a car in motion, descending, which meant someone had called it from another floor, which meant someone was using it right now at 4:53 in the morning in a hospital that ran a skeleton crew overnight and had no reason to be moving between floors at this hour unless you were one of the federal agents currently on the second floor or you were the man who had just called the nursing station landline. The elevator reached the ground floor. The doors opened. She heard footsteps, unhurried, deliberate. The footsteps of someone who is not trying to be quiet because he has decided that he controls this situation, which is its own kind of noise. She stepped out of the alcove. He was 6 feet away. He was tall. She'd been right about that from the camera feed. With the posture of a career military officer who had spent decades being the tallest person in most rooms, wearing civilian clothes that fit like a man who hadn't fully decided to stop being a uniform. His face was angular, controlled, with the particular quality of someone who had never had to do the work of making other people comfortable. He was probably 55. He looked like a version of authority that had been running so long it had forgotten it was a performance. He saw her and stopped. She looked at him and felt something settle in her chest. Not calm exactly, but the thing that comes after you've spent 3 years being afraid of a version of a situation, and then the situation arrives and turns out to be just a person. A dangerous person. A person with reach and resources and demonstrated willingness to use both against people who got in his way. But a person. "You're not at the side entrance," he said. "No." That was a simple request. "I don't have the drive," she said. "I'm not going to get you the drive. And the field notes, if you actually have them, are not the leverage you think they are." Something moved in his expression. Not surprise. He wasn't the kind of man who was easily surprised, but a recalibration. "Why not?" "Because I've already told Strand everything that's in them. The positioning discrepancy, the sequence, your report versus mine. Everything in those notes is already in the room upstairs in someone's handwritten record." She held his eyes. "You can release them to 6 recipients, or 60. The people they name already know what they contain, and they've already given their accounts to federal investigators." A pause. "You're bluffing." "Tanner's upstairs in a monitored bay with 2 agents outside his curtain. I briefed Strand and the DIA rep at 3:45 a.m. She kept her voice flat. "If you want to verify, you can call the 2nd floor. I'll wait." He looked at her for a long moment. She could see him running it, checking the logic, looking for the gap, doing the rapid internal calculation that people do when the ground has shifted and they need to find where the solid footing is now. She could see him not finding it, which was a different thing from him accepting it. "The procurement records alone don't close the loop on me," he said. "Pask is dead. Pruitt will deny direct orders. The chain—" "Pruitt was contacted 40 minutes ago by Agent Calloway," she said. "He was informed that the server access attempt was logged and traced to his credentials. He's currently in Colorado Springs deciding whether 3 years of loyalty to you is worth a federal obstruction charge." She paused. "I'm told he made a phone call at 4:38 a.m. Would you like to guess who he called?" The corridor was quiet. He stood very still, which was different from the stillness of someone in control. This was the stillness of someone who is absorbing the full shape of a loss. "Marsh," he said, and his voice had changed. Not softer, but more direct, stripped of the performance layer. "You have to understand what Sierra Kilo was. The decisions that were made wrong," she said, and then the record of them was made wrong again to cover the first wrong. She kept her voice even. "I was 26 years old. I documented what I saw because that's what I was trained to do. And for 3 years you've been managing me like I was a threat to be contained rather than a soldier who did her job correctly." She took one step toward him. "I'm done being managed." She heard footsteps on the stairwell. Calloway came through the door at the end of the corridor with Okafor 2 steps behind, and 2 people she recognized as the unnamed pair from the conference room came through the side entrance at the other end. And Marcus Red stood in the middle of a service corridor in a hospital in Tulsa at 5 in the morning and understood, in the way that certain people understand certain things only when it is fully and completely too late, that he had miscalculated the position of every piece on the board. "Colonel Marcus Red," Calloway said, and his voice had the specific quality of someone reading from a prepared document. "You're being detained pending federal charges, including conspiracy to commit procurement fraud, obstruction of a federal investigation, and witness intimidation. You have the right to—" "I know my rights," Red said. "Then we'll skip the rest," Calloway said, and Okafor moved forward. Ellie stepped back against the wall and let them work. She watched Red's hands go behind his back and watched his face during it. Watched the specific thing that happens to a man who has spent his entire life being the person who applies pressure when the pressure is being applied to him instead. He didn't struggle. He was too controlled for that. But something went out of him in that corridor, some structural element that had been holding the whole architecture upright, and without it, he looked like what he actually was. A man who had made a series of choices, each one incrementally worse than the last, until the cumulative weight of them had become too large to carry and too visible to hide. She didn't feel satisfaction. She felt tired and clear and done. The formal proceedings moved with the kind of speed that happens when federal investigators have been working a case for months and are suddenly handed the last pieces by a sequence of events nobody had planned. By 6 a.m., Pruitt had entered into a cooperation agreement with the DI field office in Colorado Springs, providing a documented account of 17 months of orders passed from read through informal channels, verbal instructions, post-meeting confirmations, the elaborate verbal architecture of a man who understood that nothing written could be taken back. By 6:15 a.m., a federal warrant had been issued for Marcus Redd on 6 counts, with additional counts pending review of the full drive contents. By 6:30 a.m., the preliminary review that Hale had arranged with Samuels convened in the second-floor conference room. It was a different meeting than Hale had planned. Strand was there. Reyes was there. Samuels sat at the head of the table with the expression of a man who has spent the last 2 hours revising his understanding of the situation he had arrived to adjudicate and is still not fully caught up. Hale sat to his left with the folder he'd prepared, which now had the quality of an artifact from a different version of the evening. A document built on assumptions that had been rendered obsolete by everything that happened after midnight. Ellie sat across from him. She was still in her scrubs. She had not slept. She had a coffee that Donna had pressed into her hand at 6:10 a.m. without being asked, which she'd accepted and was now holding in both hands more for the warmth than the caffeine. Strand spoke for about 8 minutes. She laid out the DI's involvement, the nature of the investigation, Tanner's admission to Hargrove as the initiating event, and the sequence that had followed. She spoke with the economy of someone who does not need to dramatize what is already sufficiently serious. She mentioned Ellie's service record. She mentioned Sierra Kilo by name. She placed the night's events in a context that made the phrase nurse performing unauthorized procedure sound like what it actually was, a reduction so severe it constituted a different kind of dishonesty. She handed Samuels a document. He read it. He read it twice. Hale was looking at the table. "Dr. Hale," Samuels said. He set the document down. "I'd like to hear your account of the clinical events in Bay 1 at approximately 11:54 p.m. Hale looked up. He looked at the folder in front of him. He looked at Strand, who looked back at him with the neutral expression of someone who is not hostile and does not need to be. He looked at Ellie. She didn't look away. He talked for about 4 minutes. He was accurate. She gave him that. He did not misrepresent the timeline or the outcome. What he did, which was its own thing, was talk around the center of it. He used the language of protocol and scope of practice and institutional liability, the vocabulary of a system that has rules for good reasons, and he used it to describe a situation that the rules had not adequately covered. And somewhere in the middle of those 4 minutes, she could see him hearing himself, seeing the gap between the language he was using and the thing that had actually happened. And she could see that he didn't know how to close it. When he finished, Samuels was quiet for a moment. "The patient," he said. "Commander Tanner. His current status?" "Stable," Ellie said. "Lung re-expansion confirmed on the 4 a.m. film. Drainage output is decreasing. He'll likely be moved out of monitored care in the next 24 hours. Samuels nodded. He looked at the folder Hale had brought. He looked at the document Strand had given him. He looked at the coffee ring on the table from a cup that someone had set down hours ago, which was the kind of detail that appears in your vision when you're trying to think through something that's heavier than you'd anticipated when you woke up. "The preliminary review finds no basis for suspension of nursing privileges," he said. "The clinical intervention performed by Ms. Marsh at 11:54 p.m. will be reviewed under standard case review protocol, with full monitor documentation and witness accounts, and that review will be conducted by the Clinical Quality Committee without presumption of misconduct." He looked at Hale. "The formal complaint filed against Ms. Marsh is suspended pending that review." Hale opened his mouth. "Victor." Samuel's voice was not unkind, but it was final. "The patient is alive. We'll let the committee do its work." Hale closed his mouth. He picked up his folder. He did not look at Ellie again. He left the room, and the sound of his footsteps in the corridor was the sound of a man walking away from a version of himself he'd been sustaining through authority that had just been very specifically and publicly declined. The Clinical Quality Committee completed its review 11 days later. The finding was unambiguous. The intervention performed by Ellie Marsh on Commander Ryan Tanner at 11:54 p.m. was clinically appropriate, performed with documented competence, and directly causative of the patient's survival. The committee noted that the failure to identify the tension pneumothorax prior to planned intubation represented a significant gap in the attending physician's assessment and recommended that the case be incorporated into the department's ongoing training curriculum as a teaching example. Victor Hale was not present at the meeting where the finding was announced. He had taken a voluntary leave of absence 8 days prior, citing personal reasons, which was the language that institutions use when the alternative is a more public kind of accountability. The leave was later formalized as a resignation following a separate review initiated by the hospital board after 2 other nursing staff members came forward with documented accounts of previous incidents in which Hale's clinical decisions had been questioned and the questioning staff had faced retaliatory pressure. That review took 4 weeks. The outcome was that his privileges at Hargrove were permanently revoked, and the findings were reported to the State Medical Licensing Board. Ellie heard about the licensing board referral from Donna, who told her in the corridor one afternoon, with the carefully neutral delivery of someone sharing information and choosing not to editorialize. She nodded and went back to the chart she was updating. She didn't feel triumphant about it. She felt something more like the grim acknowledgement that systems that should have caught something sooner sometimes catch it late, and late is still better than never. And never is still worse than people pretend it is when they're inside the system explaining why their hands were tied. The federal case against Marcus Redd and Gavin Pruitt moved through the indictment process with the weight of documentation behind it. The drive's contents, Pruitt's cooperation agreement, the supply manifest that had been recovered through Voight's eventual full debriefing, and the server access logs from Colorado Springs that placed Pruitt at a terminal with Redd's verbal authorization established through Pruitt's testimony. Redd was indicted on 9 counts, Pruitt on 4, with 2 others pending. The contracting company connected to the procurement modifications was dissolved by federal order, its assets frozen pending a civil forfeiture proceeding that would take the better part of a year to resolve. The Sierra Kilo field notes, the ones Redd had kept as a weapon for 3 years, were entered into evidence as part of the obstruction case, and in being entered into evidence, became part of the official record. The discrepancy between Ellie's documented account and Redd's 2021 report was formally noted, formally preserved, and formally irreconcilable with the original case file's conclusion. The Army's Internal Review Office opened a supplemental inquiry into the original Sierra Kilo investigation. She was notified of this by letter, which arrived on a Tuesday, and she read it twice standing at the window of her apartment and then set it on the kitchen counter and made coffee. Her service record was amended, not with fanfare, not with ceremony, with the specific understated mechanics of a bureaucratic correction. An updated file, a revised notation, a formal removal of the language that had described her deviation from protocol as inconsistent, and its replacement with a finding of appropriate independent clinical judgment under extraordinary field conditions. She received this also by letter. The same Tuesday, different envelope. She sat with both letters on the kitchen counter and drank her coffee and thought about the 26-year-old woman who had written those field notes by headlamp in a forward operating base with blood she hadn't fully cleaned off her hands, writing with the mechanical urgency of someone who knows that the record is the only thing that doesn't lie. She thought about what it had cost that woman to submit those notes and then watch them disappear into a process that valued the institutional version of events over the one that was true. She thought about the 7 months of making herself small, the 2 years before that, the accumulated weight of invisibility as a survival strategy. She finished the coffee. She called Tanner. He picked up on the 3rd ring, which was slower than usual, and she could hear in the quality of the connection that he was outside somewhere, wind in the background, the particular ambient sound of open space. "You got the letter," he said, without her saying anything. "This morning. How do you feel?" She considered the question seriously, which it deserved. "Like it should have happened 3 years ago," she said, "but also like it happened, which is more than I thought it would." He was quiet for a moment. "You know what I kept thinking about in that hospital before I knew it was you?" "What?" "The way you stood there when Hale told you to leave. You stood at the edge of the bay, and you didn't argue, and you didn't beg, and you just watched. Like you were waiting for the information to change. Not for him to change." A pause. "I've seen a lot of people under pressure. Most of them either fight or freeze. You just kept watching and waiting, and then you came back in." Another pause. That's not something you learn. That's something you are. She didn't say anything for a moment. Outside her apartment window, Tulsa moved through its ordinary morning. Traffic, cloud cover, the unremarkable beauty of a city that had no idea any of this had happened inside one of its hospitals on a Tuesday night in November. I'm thinking about leaving Hargrove, she said. Okay. I don't want to run. I'm not running. She was working it out as she said it. But I've been thinking about a gap in what exists for people who come back. Medics, combat nurses, field surgeons, people who've worked in high acuity environments overseas and then come home and try to fit into a civilian system that doesn't have a lane for what they know how to do. They either leave medicine entirely or they spend years being underestimated by people who don't have the vocabulary for their training. Yeah, Tanner said. There should be something, a transition program, clinical placements with real mentorship, not just a conversion course. Something that takes what people actually know and builds on it instead of asking them to pretend they're starting from zero. She paused. I know what that feels like from the inside. I know every specific way the system fails people like me because I lived inside the failure for 2 years. So build it. I don't know how to build it. You knew how to decompress a tension pneumo under a physician who was actively trying to remove you from the room, he said. You can figure out how to build a program. She almost laughed. It came out somewhere between a laugh and an exhale, which was honest. I'd need funding, institutional support, probably a hospital willing to host the pilot. I know 3 people at the VA who've been trying to get something like this off the ground for 2 years and keep hitting bureaucratic walls. He paused. And I know a DIA colonel who owes you considerably more than a favor. Strand. She thought about Strand's face in the conference room at 3:45 a.m. That fractional uncertainty when the picture had come together and she'd understood the full scope of what had been done to contain one woman's accurate account of one night's events. I'll think about it, she said. Think fast, Tanner said. I want to be ambulatory when it opens. The program took 8 months to build from the first conversation to the first cohort. It was not clean. It was not seamless. The funding came from 3 separate sources and required a grant application that she rewrote 4 times, the last version with help from a grants coordinator at the VA named Theo Park, who had the patience of someone who had been doing this work for 20 years and had learned that the important things take as long as they take. The institutional partnership was with a regional medical center in Colorado, not Tulsa, not Hargrove, a new building with people who didn't have a prior version of her to reconcile with the current one. The curriculum took 6 drafts and 2 rounds of external review before she felt it was close to what she'd meant. And even then, there were things she knew would need to change once real participants moved through it and showed her where the gaps were. Tanner attended the opening. He was fully ambulatory by then, as he'd predicted, wearing civilian clothes that still fit like a uniform, and carrying a coffee he hadn't touched. He stood at the back of the room while she spoke to the first cohort, 12 people, a mix of military medics and combat nurses in various stages of transition. And he didn't say anything during it, just stood there with the particular presence of someone who is witnessing something that matters. She stood in front of those 12 people and looked at their faces. The wariness in some of them, the exhaustion in others, the specific careful blankness that people wear when they've been in systems that didn't see them and have learned to wait before investing. And she said what she actually thought, which was that the gap between what they knew and what the civilian medical world was prepared to credit them for was not a failure on their part. It was a failure of vocabulary, and that her job and the program's job was to build the vocabulary, to make visible what had always been there. She did not tell them about Hargrove. She did not tell them about Hale or Red or Tanner or the night shift that had cracked 2 years of careful invisibility open in about 4 hours. That wasn't the point. And she knew from experience that other people's stories of vindication, however real, don't substitute for your own sense of what you're capable of. She just told them what she'd learned, which was this, that the most dangerous thing that can happen to a person with genuine knowledge is to let the systems that can't categorize them do the categorizing. That being underestimated is a fact, not a verdict, that the verdict is what you do with it. She told them about a patient, without names or identifying details, who had been dying in a particular way that she had recognized because she'd seen it before, in a context that the people in that room hadn't known she had access to. She told them that the recognition had not been welcomed, that she had been removed from the situation and then gone back in anyway. That going back in had been the most professionally risky thing she'd done in 2 years of civilian practice, and also the most obvious, because there are moments when what is right and what is safe are not the same thing, and in those moments you find out what you're actually made of, rather than what you've decided to present. She told them that what you're actually made of is almost always more than the system told you it was. When she finished, the room was quiet for a moment, in the way rooms are quiet after something honest has been said. Then someone in the third row raised a hand and asked a question about the clinical placement structure, and she answered it, and the program began. Afterward, Tanner found her outside the building where she was standing in the parking lot with her jacket on and her coffee going cold, looking at nothing in particular. "Well," he said. "Well," she said. "How does it feel?" She thought about the question the way she'd thought about his question on the phone. Seriously, because it deserved it. She thought about the woman in the oversized scrubs standing in the corner of a trauma bay, pressing a clipboard to her chest because it was something to hold on to. She thought about the 7 months of being averaged out, talked over, pointed at, and moved like furniture. She thought about the needle in her hand and the hiss of air and the monitor changing its tone. She thought about what it had cost to come back through the bay doors after being walked out. "Like I should have done it sooner," she said, "and also like the timing was exactly right." Tanner looked out at the parking lot. "I think those can both be true at the same time." "I know they can." She picked up her coffee, remembered it was cold, drank it anyway. "Thank you for saying my name." He glanced at her. "In the trauma bay? You could have stayed quiet. You were barely conscious." "Barely isn't fully." He was quiet for a moment. "You spent 3 years being the answer to a question nobody asked. I wasn't going to lie in a hospital bed and watch that happen again." She looked at him. He was looking at the middle distance, which was fine. Some things don't need eye contact. There was a particular light in Colorado in the early morning that she hadn't known about before this year. Low angle and clear, the kind that doesn't flatter anything but shows you everything accurately, which she'd decided she preferred to the alternatives. It was doing that now to the parking lot, to the building behind her with its first cohort of 12 people learning the vocabulary that the gap had cost them, to the two of them standing outside with cold coffee and the particular feeling of people who have come through something and arrived somewhere they can stand. She had spent years trying to make herself small enough to be safe. She had learned, at considerable cost, that the only people who stay safe by staying small are the ones who were never really in danger to begin with, and that being safe and being invisible are not the same thing, and that the difference between them is everything. The woman who had walked into Hargrove Medical Center 7 months ago in oversized scrubs with a clipboard held to her chest like a shield was not a lesser version of the woman standing in this parking lot. She was the same woman. She had always been the same woman. What had changed was not what she was, but what she was willing to let be seen. That was the thing about knowledge. It didn't go away because someone refused to look at it. It sat there, patient and factual, and completely indifferent to whether it was being acknowledged, waiting for the moment when the situation required it to be exactly what it was. She had been waiting in the same way. The waiting was over. The federal case against Marcus Redd and Gavin Pruitt moved through the indictment process with the weight of documentation behind it. The drive's contents, Pruitt's cooperation agreement, the supply manifest that had been recovered through Voight's eventual full debriefing, and the server access logs from Colorado Springs that placed Pruitt at a terminal with Redd's verbal authorization established through Pruitt's testimony. Redd was indicted on 9 counts, Pruitt on 4, with 2 others pending. The contracting company connected to the procurement modifications was dissolved by federal order, its assets frozen pending a civil forfeiture proceeding that would take the better part of a year to resolve. The Sierra Kilo field notes, the ones Redd had kept as a weapon for 3 years, were entered into evidence as part of the obstruction case, and in being entered into evidence, became part of the official record. The discrepancy between Ellie's documented account and Redd's 2021 report was formally noted, formally preserved, and formally irreconcilable with the original case file's conclusion. The Army's Internal Review Office opened a supplemental inquiry into the original Sierra Kilo investigation. She was notified of this by letter, which arrived on a Tuesday, and she read it twice standing at the window of her apartment and then set it on the kitchen counter and made coffee. Her service record was amended, not with fanfare, not with ceremony, with the specific, understated mechanics of a bureaucratic correction, an updated file, a revised notation, a formal removal of the language that had described her deviation from protocol as inconsistent, and its replacement with a finding of appropriate independent clinical judgment under extraordinary field conditions. She received this also by letter. The same Tuesday, different envelope. She sat with both letters on the kitchen counter and drank her coffee and thought about the 26-year-old woman who had written those field notes by headlamp in a forward operating base with blood she hadn't fully cleaned off her hands, writing with the mechanical urgency of someone who knows that the record is the only thing that doesn't lie. She thought about what it had cost that woman to submit those notes and then watched them disappear into a process that valued the institutional version of events over the one that was true. She thought about the 7 months of making herself small, the 2 years before that, the accumulated weight of invisibility as a survival strategy. She finished the coffee. She called Tanner. He picked up on the third ring, which was slower than usual, and she could hear in the quality of the connection that he was outside somewhere, wind in the background, the particular ambient sound of open space. "You got the letter," he said, without her saying anything. "This morning. How do you feel?" She considered the question seriously, which it deserved. "Like it should have happened 3 years ago," she said. "But also like it happened, which is more than I thought it would." He was quiet for a moment. "You know what I kept thinking about in that hospital before I knew it was you?" "What?" "The way you stood there when Hale told you to leave. You stood at the edge of the bay, and you didn't argue, and you didn't beg, and you just watched, like you were waiting for the information to change, not for him to change." A pause. "I've seen a lot of people under pressure. Most of them either fight or freeze. You just kept watching and waiting, and then you came back in." Another pause. "That's not something you learn. That's something you are." She didn't say anything for a moment. Outside her apartment window, Tulsa moved through its ordinary morning. Traffic, cloud cover, the unremarkable beauty of a city that had no idea any of this had happened inside one of its hospitals on a Tuesday night in November. "I'm thinking about leaving Hargrove," she said. "Okay." I don't want to run. I'm not running." She was working it out as she said it. "But I've been thinking about a gap in what exists for people who come back. Medics, combat nurses, field surgeons, people who've worked in high-acuity environments overseas and then come home and try to fit into a civilian system that doesn't have a lane for what they know how to do. They either leave medicine entirely or they spend years being underestimated by people who don't have the vocabulary for their training." "Yeah," Tanner said, "there should be something, a transition program, clinical placements with real mentorship, not just a conversion course. Something that takes what people actually know and builds on it, instead of asking them to pretend they're starting from zero." She paused. "I know what that feels like from the inside. I know every specific way the system fails people like me, because I lived inside the failure for 2 years. So build it." "I don't know how to build it." "You knew how to decompress a tension pneumo under a physician who was actively trying to remove you from the room," he said. "You can figure out how to build a program." She almost laughed. It came out somewhere between a laugh and an exhale, which was honest. "I'd need funding, institutional support, probably a hospital willing to host the pilot. I know 3 people at the VA who've been trying to get something like this off the ground for 2 years and keep hitting bureaucratic walls." He paused. "And I know a DIA colonel who owes you considerably more than a favor." Strand. She thought about Strand's face in the conference room at 3:45 a.m. That fractional uncertainty when the picture had come together, and she'd understood the full scope of what had been done to contain one woman's accurate account of one night's events. "I'll think about it," she said. "Think fast," Tanner said. "I want to be ambulatory when it opens." The program took 8 months to build from the first conversation to the first cohort. It was not clean. It was not seamless. The funding came from 3 separate sources and required a grant application that she rewrote 4 times. The last version with help from a grants coordinator at the VA named Theo Park, who had the patience of someone who had been doing this work for 20 years and had learned that the important things take as long as they take. The institutional partnership was with a regional medical center in Colorado, not Tulsa, not Hargrove, A new building with people who didn't have a prior version of her to reconcile with the current one. The curriculum took 6 drafts and 2 rounds of external review before she felt it was close to what she'd meant. And even then, there were things she knew would need to change once real participants moved through it and showed her where the gaps were. Tanner attended the opening. He was fully ambulatory by then, as he'd predicted, wearing civilian clothes that still fit like a uniform and carrying a coffee he hadn't touched. He stood at the back of the room while she spoke to the first cohort, 12 people, a mix of military medics and combat nurses in various stages of transition. And he didn't say anything during it, just stood there with the particular presence of someone who is witnessing something that matters. She stood in front of those 12 people and looked at their faces, the wariness in some of them, the exhaustion in others, the specific careful blankness that people wear when they've been in systems that didn't see them and have learned to wait before investing. And she said what she actually thought, which was that the gap between what they knew and what the civilian medical world was prepared to credit them for was not a failure on their part. It was a failure of vocabulary, and that her job, and the program's job, was to build the vocabulary, to make visible what had always been there. She did not tell them about Hargrove. She did not tell them about Hale, or Red, or Tanner, or the night shift that had cracked 2 years of careful invisibility open in about 4 hours. That wasn't the point, and she knew from experience that other people's stories of vindication, however real, don't substitute for your own sense of what you're capable of. She just told them what she'd learned, which was this, that the most dangerous thing that can happen to a person with genuine knowledge is to let the systems that can't categorize them do the categorizing. That being underestimated is a fact, not a verdict. That the verdict is what you do with it. She told them about a patient, without names or identifying details, who had been dying in a particular way that she had recognized because she'd seen it before, in a context that the people in that room hadn't known she had access to. She told them that the recognition had not been welcomed, that she had been removed from the situation and then gone back in anyway. That going back in had been the most professionally risky thing she'd done in 2 years of civilian practice, and also the most obvious, because there are moments when what is right and what is safe are not the same thing, and in those moments you find out what you're actually made of rather than what you've decided to present. She told them that what you're actually made of is almost always more than the system told you it was. When she finished, the room was quiet for a moment in the way rooms are quiet after something honest has been said. Then someone in the 3rd row raised a hand and asked a question about the clinical placement structure, and she answered it, and the program began. Afterward, Tanner found her outside the building where she was standing in the parking lot with her jacket on and her coffee going cold, looking at nothing in particular. "Well," he said. "Well," she said. "How does it feel?" She thought about the question the way she'd thought about his question on the phone. Seriously, because it deserved it. She thought about the woman in the oversized scrubs standing in the corner of a trauma bay, pressing a clipboard to her chest because it was something to hold on to. She thought about the 7 months of being averaged out, talked over, pointed at, and moved like furniture. She thought about the needle in her hand and the hiss of air and the monitor changing its tone. She thought about what it had cost to come back through the bay doors after being walked out. "Like I should have done it sooner," she said, "and also like the timing was exactly right." Tanner looked out at the parking lot. "I think those can both be true at the same time." "I know they can." She picked up her coffee, remembered it was cold, drank it anyway. "Thank you for saying my name." He glanced at her. "In the trauma bay? You could have stayed quiet. You were barely conscious." "Barely isn't fully." He was quiet for a moment. "You spent 3 years being the answer to a question nobody asked. I wasn't going to lie in a hospital bed and watch that happen again." She looked at him. He was looking at the middle distance, which was fine. Some things don't need eye contact. There was a particular light in Colorado in the early morning that she hadn't known about before this year. Low angle and clear, the kind that doesn't flatter anything but shows you everything accurately, which she'd decided she preferred to the alternatives. It was doing that now to the parking lot, to the building behind her with its first cohort of 12 people learning the vocabulary that the gap had cost them, to the 2 of them standing outside with cold coffee and the particular feeling of people who have come through something and arrived somewhere they can stand. She had spent years trying to make herself small enough to be safe. She had learned at considerable cost that the only people who stay safe by staying small are the ones who are never really in danger to begin with, and that being safe and being invisible are not the same thing, and that the difference between them is everything. The woman who had walked into Hargrove Medical Center 7 months ago in oversized scrubs with a clipboard held to her chest like a shield was not a lesser version of the woman standing in this parking lot. She was the same woman. She had always been the same woman. What had changed was not what she was, but what she was willing to let be seen. That was the thing about knowledge. It didn't go away because someone refused to look at it. It sat there, patient and factual, and completely indifferent to whether it was being acknowledged, waiting for the moment when the situation required it to be exactly what it was. She had been waiting in the same way. The waiting was over.